英语听力训练也是一种修行。接下来的练习，你只可以看到单词和短句的提示，你必须用自己的耳朵听明白整段话的意思。如果没有听懂，你可以反复多听几遍。下面我们开始吧。
How do you explain that discrepancy, especially when some of those people would have been able to apply half a year ago?
Well, I think two things. It's still a new program. The fact that people are enrolling to the program and the fact that we have more than 5 million people accepted by the program, it's a good news. Now the program is available for them. It's like, you can go to your doctor and you don't feel the need to go tomorrow morning, but you still can go to the doctor. It's just the same. This is how I see it. So people have their little card in their hands, and they will reach out to their dentist when they need.
Many patients that I've spoken to say that a concern they have with the program is the balance billing part. So that basically allows a dental clinic to charge more than what the federal government will reimburse them for. Sometimes it's more than what the provincial fee guide is as well. So I'm curious if you would consider putting any sort of restrictions or limits on what dentists or oral health care providers can charge people for these services. I think previously a lot of people thought this was free healthcare, but there are still a lot of people who say they are really surprised when they see the bill, and it's a lot more than what the federal government is reimbursing the dentist for. So would you consider putting any sort of limits or restrictions on dentists and oral health care providers?
Okay, so let me be clear. It's a new program. It's a program we built as
it's a year and a half old. It's a year and a half old at this point.
Yes, but it's still new. It's a new service that we are providing to Canadians, and we are working with a company to making sure that we are providing the services. We are monitoring very closely how fees are applied to patients, and my department is working closely also with the providers, to make sure that we can understand the cost, why the costs are applied, and we will improve within the time. If I'm considering putting some, restriction, I wouldn't say this for today.
Some Calgary doctors say they're fielding concerns from pregnant patients after the Trump administration linked Tylenol use to autism last month. Doctors say that is harmful disinformation. Calgary's autism community say it also distracts from the tangible need for support.
Alexandra Greenop is 37 weeks pregnant with her second child. She says her prenatal care team has advised Tylenol is safe for her to take.
I know a lot of people will just be online looking for similar information, and it's really hard to figure out what's useful, what's not, what can I trust, what can I not trust.
In September, U.S. President Donald Trump announced pregnant women should fight like hell not to take the pain and fever medication because it causes children to develop autism. Greenup says what people do or don't do in pregnancy is already under immense scrutiny. Numerous health organizations, including Health Canada and the Society of Obstetricians and Gynecologists of Canada, refute Trump's claim. Acetaminophen, the active ingredient in Tylenol, is the recommended over-the-counter medicine to take in pregnancy at the recommended dose.
We are already fighting many myths out there.
Staff at the Foothills Maternity Group have posted the SOGC's statement about acetaminophen throughout the clinic.
没有听明白的朋友，可以反复多听几遍。如果有需要这一段英文文字的内容，可以在评论区留言。在点点滴滴中提升自己的英文听力。英语听力练习是一场修行。那么今天视频的内容就到这里了，我们下期见。